Are you frustrated by ongoing hair loss and still haven't found the reason behind it? You're not alone. So many people spend months, sometimes years, trying different shampoos, oils, and treatments, only to see more hair on the pillow and less on their head. But here's the truth that rarely gets talked about. Hair loss often begins on the inside, not the outside. That's why topical treatments can only take you so far. If you really want to uncover what's causing your hair to thin, shed, or fall out in patches, the smartest thing you can do is get a few key blood tests. These tests act like your body's report card. They reveal nutritional deficiencies, hormonal imbalances, thyroid problems, and even autoimmune triggers. In this video, we'll walk you through each of the essential blood tests you should consider to finally get to the root cause of your hair loss. Let's start with the basics, the complete blood count, or CBC. This test gives a snapshot of your overall health, but more importantly, it can detect anemia, which is one of the most common hidden causes of hair thinning, especially in women. If your hemoglobin levels are low or your red blood cell count is off, your hair follicles might not be receiving enough oxygen or nutrients to stay healthy and productive. A simple CBC test can uncover this in minutes and help you take the right steps toward recovery. Next up is the Ferritin test, which measures your body's iron stores. What many people don't realize is that even if your general iron levels seem okay, low ferritin can still trigger significant hair loss. Ferritin is like your backup iron supply, and it's crucial for supporting healthy hair growth. Ideally, your ferritin levels should be above 70 nanograms per milliliter for optimal hair health, even if labs tell you a lower level is normal. If your levels are too low, your hair follicles may go into a resting phase, which leads to excessive shedding. Now let's talk about something that often flies under the radar: your thyroid. Your thyroid controls your metabolism and has a direct impact on the health of your skin, nails, and yes, your hair. Tests like TSH, free T3, and free T4 help determine if you're dealing with an underactive, hypothyroid, or overactive, hyperthyroid thyroid. Both conditions can cause hair to fall out more rapidly and affect its texture. If you've been feeling unusually tired, cold, or anxious, or if you've noticed changes in weight or energy levels, these are signs that your thyroid could be out of balance. Another key piece of the puzzle is vitamin D, a nutrient that supports new hair follicle growth and helps regulate the immune system. Low vitamin D levels are incredibly common and can play a major role in hair thinning. A simple blood test will show whether your vitamin D levels are within range, and if they're not, supplementing correctly can make a big difference in your hair health over time. Let's not forget vitamin B12, which helps with red blood cell formation and oxygen transport. If you're deficient, your hair follicles may not be getting the nutrients they need to thrive. B12 deficiency is especially common among vegetarians, vegans, or people with digestive issues that affect absorption. Adding this test to your list can help rule out another silent cause of hair loss. Zinc is another vital nutrient that often gets overlooked. It plays a key role in tissue repair, immune function, and maintaining the oil glands around your hair follicles. Low zinc levels have been linked to both telogen effluvium, a type of temporary hair shedding, and more chronic forms of hair loss. A zinc test is easy to include in your blood work, and if your levels are low, even minor supplementation can help. For women, hormone testing is absolutely essential, especially if the hair loss is concentrated around the crown, temples, or comes with other symptoms like acne, irregular periods, or unwanted hair growth on the face or body. Blood tests such as free and total testosterone, DHEAS, LH, FSH, estrogen, and progesterone can reveal whether you're dealing with a condition like PCOS or androgenic alopecia. These hormonal imbalances can cause the hair follicles to shrink over time, leading to progressive thinning. In some cases, your immune system might be the root of the problem. If your hair is falling out in patches or comes out in clumps, an autoimmune condition might be responsible. Blood tests like the ANA test, anti-nuclear antibody, can help detect conditions like alopecia areata or lupus, which cause the body to mistakenly attack its own hair follicles. These conditions need medical treatment, not just cosmetic solutions, so identifying them early is key. And finally, based on your symptoms, your doctor might recommend other tests like CRP or ESR to check for inflammation, blood sugar and insulin levels to rule out insulin resistance, or even a scalp biopsy in rare cases to analyze follicle health directly. As you can see, finding the cause of hair loss isn't a guessing game, it's detective work. And the best part? The answers are often just a blood test away. Once you identify what your body is lacking or what systems are out of balance, you can take real, effective action to stop hair loss and start seeing real regrowth. If you found this video helpful, go ahead and give it a thumbs up, and don't forget to subscribe to Hairfall Detective for more in-depth videos, expert-backed tips, and simple solutions to uncover the truth behind hair loss.